Can you talk to us about what pelvic floor exercises are? Because frankly, I never heard about it until you came up and I started exploring what it was. And it's like, wow, that's a whole other field I had no knowledge of. And I'm sure that there are many people out there who might not have heard it. So go on.
Absolutely. I am happy to talk about this. It's a growing field, thankfully, and especially because urinary incontinence, as I said, which is a big part of what I treat, is not normal, is not something anyone should have to live with as part of normal aging, for example. And so I love that more and more people are figuring out that it exists. But in general, pelvic floor PT, there's a hammock of muscles that sits in our pelvis. They're muscles like any others in the body, so they need both full range of motion and strength in order to be able to function properly. And when that comes to issues of incontinence, that means if I go to hold it, do I have the range of motion and strength to do that? For most women, instead of strengthening, which I think is what we have traditionally thought we need to do if we're leaking, for example, we actually don't have a problem with strength. We have a problem with range of motion. And so the example I often give is with the bicep, right? If you put a heavy weight in my hand out here and you ask me to contract against it, it's going to be hard. The muscle fibers are far apart. They can't get purchase on one another. That's like 2% of the people I treat, and they're ready to strengthen right out the gate. So they're ready to do some of what we're familiar with as Kegels or things like that. But 98% of the people, and in particular the women I treat, are all the way up here. So now, if you put a heavy weight in my hand and you ask me to contract against it, there's nowhere for me to go. So I may think I'm doing a Kegel or closing off, but if I'm already up here, it's not going to be effective. And so if I'm doing Kegels also with a pelvic floor that is really tight, I'm not going to strengthen this bicep until I get full range of motion at my elbow, right? And so most women and most people in general, the first thing they need to do is not Kegels. They need to focus on diaphragmatic breathing, manual therapies, things like that, that can get us full range of motion in the pelvic floor. And the way this relates to sex often is people who have pain with sex, in particular pain with penetration. It's called dyspareunia. And for those people, a lot of times they have a lot of that increased tone. And if I have a lot of that tone, whether it's at rest or because I'm guarding, maybe I have some trauma history that relates, maybe I'm guarding because I'm afraid of pain, whatever. Penetration could be painful for me then because it's like I'm getting this really unpleasant stretch of my tissue every time I'm attempting penetration. So pelvic floor plays a role in bowel, bladder, sexual function.